The clinic is now facing more than 100 lawsuits. Joining us now, Jack Landskroner, who's an attorney representing a number of those clients. Appreciate you taking some time to join us here. So more than 100 lawsuits we know of right now, but they are not in a class action lawsuits. You are filing all of these individually. Why?
Well, Erica, what we're doing is evaluating our clients' individual needs. Many of our clients' needs are immediate, and at least for our clients and the evaluation of these cases, we determined that it wasn't in their best interest to be part of a class action. Class action is great if you have a defective car engine or you have a stock loss, but these people lost their potential to have a family, and so we believe their individual claims have to be pursued so they can tell their fertility journey, because each case is truly a story.
You mentioned, too, for some of them, their needs are immediate. And in terms of telling that story, part of what happens with some of these lawsuits, as callous as it may sound, it isn't. Part of it is trying to put a price on something. But how do you even begin to do that with a loss like this?
Well, it's very challenging. There's no right or wrong answer. There is evaluating each client's case individually. There are, of course, economic losses that people have endured as a result of costs of procedures and storage and future costs of care if they need it. But there are the intangible losses, which often are left to a jury to decide.
Mm-hmm. In terms of the families, in the ones that we've spoken with, this is obviously a roller coaster, and they have told us this is a grieving process, and so they're going through those steps of grief right now. How are some of your clients doing at this point?
Well, I mean, it's a tragedy across the board. There's no question about that. I think everybody is hurting, and incredibly, some have come forward and been great advocates for the issue and the concerns that everybody is dealing with. And in fact, we've been approached through the advocacy work we've been doing by some people in the community who've been good enough to call, who had frozen embryos stored at other facilities outside of the university hospital systems. And they've been willing to donate their embryos because their families were complete, and they feel like they're a part of this tragedy because they've been through this process, and they want to help those people who have been affected. And so incredibly, this community is coming together to rally around these people in the process of trying to get these issues sorted out and resolved.
That is pretty remarkable and selfless as well. What are you hearing from the hospital?
Well, we're in communication with the hospital. Our goal is not to file every one of these cases as a lawsuit. Our goal is to follow our clients' lead, take their best interest at heart, hear what they need and what their desires are, and move forward accordingly, and to talk to the hospital. And the hospital has been willing to talk to us. We have obviously a lot of clients that we represent, and they've been willing to sit down and have a conversation, which we intend to do as we progress through this process. And if we can't get to resolution, then the backdrop, of course, is always a lawsuit.
Well, we'll continue to follow the developments, and please keep us posted, too, on your end. Jack, appreciate it.
I'd be glad to.